I would say that when there is something significant that has been identified and a repeated pattern of behavior, that is when we engage in a consent order.
Tonight, we're taking a deeper dive into the complaints and issues substantiated by the Connecticut Department of Health regarding St. Francis Hospital in Hartford and its ongoing consent order. Thanks for joining us here on the Fox 61 News at 11. I'm Sarah Sanchez. The commissioner for the state's Department of Health cited issues and errors in medication administration, sanitation, staffing, and the safety of patients. Fox 61's Antoinette Montgomery first brought you this story on Saturday, and she has kept combing through those documents provided by state health officials, and she sheds now more light on how the hospital plans to correct the issues.
Dr. Manisha Jutani, the commissioner for the state's Department of Public Health, tells me one of the department's main functions is to ensure the safety of facilities. The department wants to make sure people feel confident going to a given healthcare institution. It's the reason Dr. Jutani says state health officials felt more oversight was needed at St. Francis Hospital.
When there are complaints that come to us as a department, we go in and investigate. So we may go in to do regular survey, we may go in for investigations. In the context of that, we had identified several violations that had occurred.
Dr. Manisha Jutani is referring to violations she says health officials uncovered at St. Francis Hospital.
Our oversight is meant to protect the public, hold institutions accountable for what they need to do.
At St. Francis Hospital, Dr. Jutani says that oversight is in the form of a consent order.
But I wouldn't call it a common occurrence. I would say that most of our institutions, we hope, are upholding the standards that we would like.
An example referenced by the Department of Health and its investigators is laid out here. An environmental risk assessment, or ERA, is required by health officials to identify, evaluate, and control potential hazards for patients. In this plan of correction from the commissioner to the hospital dated March 24, 2025, it says a review of documentation and an interview in September and October of 2024 with the facilities director revealed that the ERA plan had not been reviewed, revised, or updated since June 2020.
Sometimes patients can be a harm to themselves. Sometimes patients could be in situations where they unintentionally or intentionally could harm themselves. And creating situations that ensure patient safety is another major area of focus from a healthcare quality and safety standpoint. We have certain standards that CMS, the federal agency, gives us to ensure that our local hospitals, in fact, are meeting.
In response, the hospital says it created an event work order to ensure the risk assessment is reviewed, revised, and/or updated annually. In another instance from September of 2024, cited in state documents, the Department of Public Health says the hospital failed to properly document a patient on suicide watch was prone to ingesting objects. State health officials go on to say the hospital failed to adequately supervise that patient and make sure the environment was safe. The department says while the patient was supposed to be on supervised watch by the hospital, the patient swallowed a needle, shower curtain hook, a plastic bottle cap, a crayon, and was transported to another hospital for surgery. As a result, immediate jeopardy was identified, which means
the summary would be that it is something where a patient's life could be in immediate jeopardy, where there is immediate harm or potential threat to safety. If it is something that is life-threatening, something which we determine to be something that might be what we call immediate jeopardy, something where somebody's life could be jeopardized immediately.
In response to this incident, the hospital said it would provide all ABC and CAPS behavioral health staff with in-person education on ingestion disorders starting in October of last year. I reached out to Trinity Health, who oversees St. Francis Hospital, for comment regarding the issues and concerns from the State Department of Health when I first covered this story. And they sent me this statement that says, in part, throughout this process, we have worked collaboratively with both the Department of Public Health and the independent consultant to reinforce best practices and maintain the highest standards across all hospital operations. We self-reported all required events in full compliance with DPH guidelines applicable to all Connecticut hospitals. And we have their full statement right now on fox61.com. In studio, Annette Montgomery, Fox 61.